There is something about the Nclex that many students don't realize until it is almost too late. And that is how a single topic, just one, can appear in many different forms, with many different clues, and with many different twist questions that completely change the diagnosis. And nothing proves this more than the topic of embolism. Today, I want to take you into a then and now story that will help you never miss embolism questions again. In this story, we follow Carol, a dedicated Nclex student who genuinely studied but still kept failing all embolism-related questions. Then we will step into her now, the moment everything clicked, and she finally understood the whole picture clearly. Carol used to feel confident whenever she saw questions about shortness of breath, chest pain, or sudden changes in a patient's condition. She believed she knew them all, until the Nclex-style questions started mixing them up. One day it was sudden dyspnea during hemodialysis. Another day it was confusion and petechiae after a femur fracture. Then a sudden collapse during labor, or chest pain 3 days after surgery. And every single time, she chose the wrong embolism. Her then looked like this. She kept thinking that every breathing problem was pulmonary embolism. She didn't know the subtle clues. She didn't know the timing differences. She didn't understand why symptoms overlapped but the causes were completely different. And because the Nclex hides important clues inside the scenario, Carol kept missing the cue that mattered the most. What caused the embolism in the first place? But all that changed the day she finally understood how embolisms are created. That was the moment her now began, when everything clicked into place and she could differentiate them instantly, just like the Nclex expects. Embolism simply means that something is blocking blood flow. But the Nclex will never ask you, what is an embolism? Instead, it will say, a postoperative patient suddenly develops difficulty breathing. A patient with a femur fracture becomes confused and has a petechial rash. A woman in labor suddenly collapses with cyanosis. During central line removal, a patient becomes hypotensive and dyspneic. 4 different patients. 4 different causes. 4 different emergencies. The moment Carol understood this, she began seeing each embolism type as a story. Pulmonary embolism became the story of a clot that travels from a DVT after surgery, immobility, or long bed rest. She finally recognized the Nclex clues: sudden dyspnea, pleuritic chest pain, tachycardia, low O2 saturation, and the classic postoperative timeline. Now she knew the first response was always to call the rapid response team, support oxygenation, and prepare for anticoagulation. Fat embolism became the story linked to long bone fractures, often the femur. She learned the 24-72-hour window, the sudden confusion, the tachypnea, and the characteristic petechial rash that Nclex loves to use as the giveaway. Her now moment was realizing that this rash is the differentiating clue. And the correct response: oxygen support, 4 fluids, and monitoring. Not antibiotics or unnecessary bone movement. Air embolism became the story of improper central line handling, during insertion or removal, or sometimes dialysis. The symptoms remained the same: sudden dyspnea, chest pain, hypotension, anxiety, and the mill wheel murmur. But what changed everything for Carol was learning the correct emergency position, Trendelenburg, left side, and clamping the line immediately. Amniotic fluid embolism became the story of sudden collapse in a laboring or postpartum woman. The Nclex doesn't make it subtle. Severe hypotension, respiratory distress, cyanosis, shock. The moment she saw those signs in a woman who is pregnant or just delivered, Carol finally knew what to look for and what to do. Call a code and prepare for advanced life support. Deep vein thrombosis was no longer confusing. She understood it as the root, the starting point. Unilateral swelling, warmth, redness, tenderness, and the most important action: assess for signs of pulmonary embolism immediately. Now Carol could recognize every embolism because she knew their stories, their causes, their timelines, and their unique clues. And that is the transformation every Nclex student must go through. Because this is where the Nclex tests your true readiness. Not by asking definitions, but by giving you clinical clues. And this is where your performance level, below passing standard, near passing standard, or above passing standard, becomes extremely important. Below passing standard means that in these categories, you consistently misunderstand concepts or pick unsafe answers. It means you're not yet able to apply clinical reasoning, and this automatically leads to an Nclex fail. Near passing standard means you are close, but still inconsistent. You may understand some embolisms but confuse the subtle clues. You may get some questions right, but not reliably. Nclex does not want almost ready. Near passing standard is still a fail. Above passing standard means you understand, you recognize cues correctly, you respond safely, and you consistently make sound clinical decisions. This is the level every student must reach in each Nclex category, because the exam measures competence, not luck. Carol moved from below passing standard to above passing standard the moment she stopped memorizing questions and started understanding causes, connections, and consequences. And that is the same transformation I want for you. Because when the Nclex tests embolisms, it expects you to instantly separate a clot embolism from a fat embolism, a fat embolism from an air embolism from an amniotic fluid embolism, a DVT from a PE. This is why I brought you this then and now story, so you can clearly see the journey from confusion to mastery. I don't want you to be the student who gets stuck because symptoms overlap. I want you to be the student who walks into the exam confidently, ready to pick out the right clues, prioritize correctly, act safely, and score above passing standard in every category. And now that you've seen these embolisms through Carol's now, you will not forget their clues, their causes, or the first interventions. This is exactly the level of understanding the Nclex expects, and exactly the level you will operate at.